In terms of positive stuff that we're going to hopefully see at this year's ASCO, I think a lot of people are interested in some of the smaller niche molecular abnormalities that may be targetable. So EGFR exon 20 insertions, that's maybe about 10% of EGFR mutations. We're going to see data with the TAC 32788 drug, which is reporting about a 40% response rate. That's looking comparable to the poziotinib data we've seen before. We're going to see updates on the LOXO drug in RET positive non-small cell lung cancer. That's showing about a 60+% response rate. Again, looking like that's going to be a real targetable abnormality, just that we've also seen similar data with Blue 667 at AACR. And I think in the immuno-oncology front, two things. One is we're going to see that chemo-immuno approach showing fruit in the squamous population, which I think we're all excited about. And perhaps the most controversial topic, which is going to be in the plenary session, is pembrolizumab monotherapy in those who have relatively low tumor proportion score. And the question is it all just driven by the high TPS group relative to chemotherapy, or is there some benefit? And if it's just kind of equivalent to chemotherapy, is that enough that's going to shift people's practice? So some of the breakthroughs at this year's ASCO are negative as much as they are positive. So we've just come from a session which was looking at the potential of immuno-oncology, PD-1 and PD-L1 antagonists, to be combined with ALK inhibitors in ALK-positive lung cancer. And the results, I think, were very sobering. They did pretty much nothing other than add toxicity. There wasn't a single shred of evidence that they increased efficacy. All of the efficacy looked like it was what you would get from the TKI alone, and certainly sometimes the tolerability was very poor. I think this is a field that needs to say, we tried it on the basis of not very much science, and we need to move on. Maybe there are other situations where you can make these things immunogenic, but just simply combining them with the tools we currently have is not the way to go.